So, Kui, what are some of the ways health system managers can identify and rectify the effect of gender within the health system? Do you have any practical tips?
Good questions. You're just throwing hard questions at me, Angela, but I'll do my best to answer. So, but first of all, before I answer that specific question, I think one thing that I really would want the audience to go away remembering is that for us to see any meaningful and transformative change when it comes to gender equity, we have to remember that gender is everyone's business, right? It's not just the health systems manager's business, or women's business, or whoever's business. It's everyone has to play a role for us to start seeing meaningful and transformative change, for us to rectify the situation. Everyone, whether that's the community, citizens, health system managers, policy levels, policymakers at all levels of government, everyone has to play a role, because as we were saying earlier, these things operate within a broader context or system of patriarchy and all of these other broader structural and societal systems that cannot be changed by just the health systems managers, right? And also important to remember that gender inequity harms all of us, and so that's why I think we all have a stake in rectifying the situation, to use the word that you used. But I do think that yes, there are certain things that individual health systems managers can do, but also I'd like to acknowledge that we must remember that these managers are working within the constraints of the system itself, right? So the health system does not always operate optimally, and so we need to remember that these managers are working within a system that might not always operate in the most optimal way. As individuals, I think one of the things one can do is really even just start speaking out. If we stick with the theme of human resources for health, which has kind of framed most of our conversation today, of course, there are very many things one can do, even in terms of thinking about the service users and how can we make sure that there's kind of gender equitable ways and dignified ways of treating service users. But if we stick with human resources for health, because that's what we've been focusing on today, I think it's even just about speaking up. And the advantage of this is that we now have the buffer of the law. So for example, we have very many policies and acts in Kenya around public service employment, diversity and equity in public service employment, and even gender equality is now enshrined into our constitution. So if you're, for example, sitting in a community health management team or a sub-county, sorry, I meant a county health management team or a sub-county health management team where there is no gender diversity, you can actually just speak up about that and frame it in the context of the law. If you're worried about people saying, this person, like, why are they challenging us or whatever, you could actually just frame it in terms of the law, because the law is very clear now that for elective and appointive bodies, we must have at least, the whole a third gender rule that people talk about a lot. So you could speak up in the context of the law, like, I think there's something amiss with our management team, because we all kind of look alike. We don't have gender diversity in this team, and that sort of thing. So I think number one is just to start speaking up, whether it's about gender equality in terms of the leadership and management teams. Start speaking up, whether it's about things to do with sexual harassment, and we do have laws and policies in Kenya around these sorts of things. So one can always just speak up and buffer yourself with this is what the law says. Like, it doesn't even matter what we think here in this space. This is what we're doing is not, it's against the law. It's not quite it's not in accordance with the law. So I think people can make small changes in whichever space they are in, and just speak up about these sorts of things. I acknowledge that it has to be small baby step changes. There'll not be any kind of big miraculous changes that will happen overnight. But if you can even just be the person who starts speaking out, or who encourages the people. If it's, for example, in the you were talking, our previous question was around people who are working with remote and rural communities. It could just be that you're the person who raises some awareness around, by the way, as per law right now, your health facility committee actually is not constituted quite according to the law. You know, it's just putting it out there and then allowing them to kind of think about that and see what they can do to change that. So it's a difficult it's a difficult question, and I don't really have like any clear or concise response to give. But what I can say is that we can all make little changes wherever we are. I really believe in the idea of leading from where I stand, shining a light from my little corner of the world. And even if it's just about speaking up, I feel I've done enough. At least I've said something, and then I can leave people thinking about it, or I can catalyze or instigate some change. And I have seen this even in my own organization. I'm not at the kind of executive top management, but just saying some things to the people in management, like, by the way, have you thought about this? Or by the way, I don't think this is quite okay. And over many years, I've started seeing these things now sinking into people's conscious and people starting to really think about them. And then I start being called into committees. By the way, we are thinking about gender equality and gender diversity in our own institution. Can you sit on this committee and come and have a discussion with us? So sometimes it's just about planting the seed and continuously planting the seed and not tiring of planting the seed. And then you hope that the fruits will one day come to bear.
All right, that brings us to the end of this fascinating conversation. Thank you so much, Dr. Kui Muraya, for joining us today and reminding us that health systems are not inanimate. They're made up of people who bring their norms and biases. Dr. Kui's contacts will be on the screen should you want to reach out to her and follow up on any bits of this conversation that we have had today. And thank you all for joining us for this session. Have a good rest of your day and goodbye.